This is Colleen Fitzwater from the Lobular Breast Cancer Alliance. Today, I'm joined by Dr. Candace Frerich. She's a postdoctoral researcher at UT Southwestern Medical Center in Dallas, Texas. Dr. Frerich was recently awarded the AACR Lobular Breast Cancer Alliance Invasive Lobular Carcinoma Research Fellowship. Dr. Frerich, congratulations on your award.
Thank you.
My first question for you is, can you tell me briefly about your background?
So I am a postdoctoral researcher at UT Southwestern, which means I just recently finished my PhD work. That was in Albuquerque at the University of New Mexico. In the past, I've studied a rare salivary gland cancer. And now, as you know, I've transitioned to studying lobular breast cancer. My interest is really on a type of protein called transcription factors, which control what the cell kind of does on the most basic level.
Next question is, it's my understanding when you first went to UT Southwestern, your focus was on invasive ductal carcinoma. Can you tell me how that work led you to want to research lobular carcinoma?
That's correct. So historically, the lab that I'm in is run by Dr. Suzanne Conzen, and she made the discovery a few years ago that the glucocorticoid receptor, which is the body stress hormone receptor, is important in ER-positive breast cancer. And ductal is kind of the most prominent ER-positive breast cancer. But we were wondering if her results that she found could be applied to lobular breast cancer. And she sees patients in the clinic. And so she got a lobular breast cancer patient, and it kind of made her realize that there's this need for research into lobular breast cancer, and maybe our results from ductal breast cancer could help lobular patients as well.
What made you apply for this fellowship?
We actually have kind of newly come to the field of lobular breast cancer research. So the fact that this fellowship is specifically geared towards lobular breast cancer really appealed to us, to try to help us shift our focus from ductal to lobular.
The title of your research is Modulation of Glucocorticoid Receptor Activity to Prevent ILC Progression. First, can you explain what glucocorticoid receptor is?
So the glucocorticoid receptor, and we can call it GR from now on, and that's what we call it in the lab all the time, is the body stress hormone receptor. So whenever you get stressed, you release a hormone called cortisol, and that binds to GR and tells the cell how to respond to this stress. It's typically thought to be immune suppressive. So if you think about asthma, glucocorticoids are prescribed to asthmatics to calm down an immune response and help them breathe. But we have found glucocorticoid GR is important in many, many different cancers. And we're trying to figure out if it does similar or different things in ILC. And the kind of really important and great thing about this lab is we have drugs that are in phase 1 trials for, not for cancer, but for other diseases, that could be, if we find interesting results, they could be used in the clinic relatively soon since they're already in phase 1 trials.
Explain to me a little bit about what the aims are of this research.
Yes, so aim 1 is kind of focusing on really establishing the role of GR and what tumor cells can do, and then inferring how that might relate to the patient. So we talk a lot about GR limiting proliferation of tumor cells, which would translate to GR stopping a tumor from growing in the patient. And if we can harness GR's ability to do that in a patient, then we can slow the tumor growth and prolong survival. The other thing that we are interested in is how cells stick to each other and other surfaces, other substrates in the body. And this is important during metastases because cells sticking to each other and other surfaces and invading surfaces is how cells metastasize. So our first aim is to characterize those things and GR's role in those processes. And then our second aim is to translate that into in vivo studies in mice and kind of confirm that our work actually is repeatable in a body.
I know you had a poster at SABCS 21. So for those of you who may not have seen it yet, can you give us a quick summary?
Yes, so the poster was kind of our studies so far. And so far what we've done is look at GR expression in patient samples and show that GR is correlated with better survival, which gives us hope that our studies might be important to a patient. And then we've also shown that GR is able to slow proliferation of a cell line. So hopefully that would translate to slow tumor growth in a patient. And we've identified a adhesion molecule that is also correlated with survival in ILC patients. And again, we're hoping that if this molecule is important and we can turn it on or off with GR, then we can help patients survive longer and reduce metastases.
How might the findings from your current research, what is being funded, help people with lobular breast cancer and metastatic lobular breast cancer?
So our hope is that if we find out GR is important and the drugs act in a positive way on our cells and our mice, then we would translate that into a phase 1 trial with these drugs that are well tolerated in phase 1 trials already. And our hope would be that it would either stop or shrink their tumor and prevent metastases.
As you know, LBCA is an advocacy organization. So my next question for you is, I know that one of the requirements of this fellowship was collaborating with a patient advocate. And reading your materials, I understand you already had a working relationship with a person with ILC. Is that correct?
Yes.
And can you explain a little bit of the background with her that was already in place?
Yeah, it was, she's kind of this really great active woman, and she contacted us and said, I had ILC and I think UT Southwestern needs to kind of change up the way they think about it because they treated me the same as a ductal patient and I shouldn't have been. So we had an initial conversation, and then the more formal arrangement of working together with her as a patient advocate was derived when I applied for this fellowship.
And so you have your application and you see you need patient advocate perspective. How did that patient advocate perspective help when you wrote your grant application?
As a non-clinical scientist, it's hard for me to get a sense of kind of what goes on with a patient, with a breast cancer patient in the clinic. And so she provided that insight. And it's a different insight from the view that my boss gives, who is the medical doctor on the other side. So that was the benefit to having a patient advocate.
Great. So I have a final question for you. Lobular Breast Cancer Alliance believes that ILC is understudied and that more research is critical to advance our understanding of lobular breast cancer. Can you tell me why you personally think that this is important, these studies?
This is a really hard one because you already answered it. So if we don't have enough studies of ILC and we can't really say what's different between ILC and IDC, we can't treat ILC appropriately. And in my own studies, I have noticed this as well. Data sets for IDC are large, and there's many examples of how the tumors behave, but for ILC, it's just not as large. I mean, it's not an uncommon tumor. It's 15% of all breast cancers is a lot of women. So it's important.
Dr. Frerich, for taking the time to talk to me today. We really look forward to your research findings.
Thank you for having me.